Dry skin brushing. Dry skin brushing is a technique in which the skin and lymphatic system is stimulated with a natural bristle brush, rough hand mitts, or textured cloths. Dry skin brushing increases local blood flow to the skin, bringing fresh oxygen and nutrients to the skin. The sebaceous glands are stimulated, and dead skin cells removed to reveal the healthy new skin below. Dry brushing is a wonderful enhancer treatment before a full body massage. Dry skin brushing techniques. Use a natural fiber brush with a very light pressure on dry skin, working from distal to proximal with short, rhythmic strokes. Dry brushing works best when it's done in brisk, straight lines with very light pressure. Let's review specific techniques for each body area. Posterior legs. To brush the inner thigh, stand at the client's hip facing towards the foot of the table. Pull the brushes towards the lateral side of the leg using light rhythmic strokes. To brush the lateral thigh, stand by the knee and run the brushes briskly upwards towards the hip. Use short, overlapping strokes. Brush the entire posterior leg with these light rhythmic strokes from the ankle to the hip. Back and arms. Brush from the fingers to the elbow and from the elbow to the shoulder. Stand on one side of the client, facing across the client's body. Place the brushes on the far side of the client and pull them in light strokes towards the spine. Move around the table to the other side of the client in order to repeat the side brush. To dry brush the main area of the back, stand at the head of the table and begin the stroke at the sacrum, pulling the brush towards the head of the client. To ensure that the strokes are rhythmic, only brush as far as the mid-back. Use a separate set of strokes from the mid-back to the shoulders. Anterior legs. When dry brushing the anterior legs, start with the medial leg by standing at the client's hip and facing towards the foot of the table. Each stroke runs from the medial side of the leg to the midline of the leg. To dry brush the top of the leg, stand by the foot and brush upwards towards the knee with light overlapping strokes. Repeat the same action to the lateral side of the leg. It should be noted that when working on the limbs, many therapists prefer to work the proximal section of the limb first, for example, from the knee to the hip, before working the distal section of the limb from the ankle to the knee. Abdominal area. To brush the abdominal area, stand to one side of the client and brush from the far side of the body towards the center line. Standing at the head of the table, pull the brushes upwards in a straight line towards yourself. Finish by brushing the sides of the client from the hip to the armpit. Chest and arms. Stand at the head of the table and brush from below the navel, pulling in a straight line between the breasts with overlapping strokes. If using a breast drape, simply lift the brush and jump over the drape to the chest. Brush briskly across the top of the chest and then up the arms. Feet. Brush the feet from the toes down to the heel. Brush firmly to avoid tickling the client, but if they are too ticklish to tolerate this, skip the feet and move on.